Welcome back to Phlebotomy Solutions video PowerPoint presentation. Today we're going to be talking about roles and responsibilities, consent, and ethical conduct. One of the roles and responsibility of phlebotomists is patient identification. This is the most important factor and the most important role of a phlebotomist. Obtaining correctly the patient identification. Prior to any patient procedure, proper identification is a priority. Proper identification of the patients is a three-step process that we're going to discuss. Now, the three-step process is as follows. 1, ask. 2, compare. And 3, validate. What does this mean? 1, we ask the patient to state their name, their full name, first and last. What we don't do is we don't tell the patient their name. We have them tell us their name and spell it first and last name. Number 2, we compare the name on the test requisition form to the patient's response. Now, this is important. Also, number 3 is to validate patient identification by checking the armband or the date of birth. One thing you can do also is after you are done comparing all three, ask, compare, and validate, you can draw a circle on the requisition or on the label and ask the patient, is all the information correct? And if they say yes, then you can have them initial in the box to verify that they approved of the information that was provided to you. This way, if anything comes up later that something is wrong, you can go back to the patient as signing off that the patient identification was correct. Another role and responsibility of the phlebotomist is professionalism and communication. For example, well-groomed. Now, this means that we need to follow the hospital or the lab's policy on how our uniforms should be pressed or how they should look, how we should dress. We got to make sure that we're following the guidelines that are set by our employer. Therefore, we need to have our nails trimmed. As a phlebotomist, we need to have the proper amount of jewelry. Sometimes we're only allowed to wear one ring, no long necklaces, no long hoop earrings. As a woman, you need to have the hair pulled back and not dangling on the patient. Sometimes we need to make sure we don't have too much cologne or perfume that could irritate the patient or cause an allergic reaction. We got to make sure that our uniforms aren't wrinkly like we just slept in them and just got up and went to work. We got to make sure that we are properly groomed and look like we're ready to work in a professional manner. We also got to talk about the ability to communicate. When we're talking to the patients or we're talking to other colleagues, we got to be able to talk professionally and relay what we want, what the patient needs, what the doctor has ordered. We got to make sure that in all the surroundings we are communicating professionally in an ability that's set forth by the standard of the hospital, as well as explaining the procedures. When we go into a patient, we let them know that the doctor ordered some blood tests. We can let them know what the blood tests are. But if they want more information about the test, then we can let them know that when the doctor comes in, that they can communicate and ask the doctor, and the doctor will explain and answer any questions that they have. Now let's talk about ethical conduct of a phlebotomist. Ethics consists of written rules, procedures, or guidelines that examines values, actions, and choices to help determine right from wrong. Patient confidentiality is a silence, a shh. We never talk about patient information in an open environment or open surroundings. This is following what we have in our other PowerPoint of HIPPA. So let's get into a little bit more about the ethical conduct of a phlebotomist. So ethical conduct deals with patient information. All information regarding patient care is privileged information. And patient information should only be given out only when it related to a patient's treatment. And even this needs to be given to the family members who are there who have authorization to get patient information. This also includes if you get phone calls from people claiming to be family members. A lot of times the hospitals and labs will give out certain code words or numbers that are associated with the patient so you can identify who's calling if it's a family member who is entitled to the information. Other than immediate family and those who have the right, all patient information must be guarded and protected. We are not allowed to give out information to just anybody or even talk about patients in an open surrounding. Now let's talk about legal and ethical issues of a phlebotomist. 1. Refuse treatments. Who can refuse treatments? 2. Giving permission. Patients may refuse treatments at any time. Patients must verbally give their permission and demonstrate an understanding of what will happen, which is referred to as informed consent. Now let's look at a couple of scenarios. If you have a healthy individual in the hospital who's fully capable of making a decision of not receiving a blood test or a blood draw, then he has every right to refuse treatment. And you cannot force the treatment on them. Now, if they are sedated or if they are not able to respond, then of course this is left to the legal guardian or the adult who has responsibility there to make that decision, or even the doctor if they're given that permission or that authority. Now, if you have a minor who's under 18 and the parent is telling you to draw the blood, then you must draw it regardless of what the minor tells you. They have no right to refuse. The parent are the guardians. Now, if you have patients who are in prison or if they're in psychiatric wards, then again, they do not have the right to refuse. You must draw the blood as ordered by the physician or the doctor at the time. Now, this is also important with demonstrating understanding of what will happen, is that you need to make sure that the patient understands what you're saying, whether they verbally tell you, yes, I understand, or you communicate with them and get a response that meets that standard. Sometimes you will have a language barrier that you need to find out if they understand what you're saying. If they don't speak English, then we might have to bring somebody in to help translate, or they might be hard of hearing because they're an older patient. This is why we talk to them. We do the patient ID and validate and confirm and have a conversation about what the doctor ordered. This will give you a better understanding if the patient truly understands and is able to give you informed consent. Another area of legal and ethical conduct is assault and battery and under 18. Now, you can be legally charged with assault and battery if you fail to obtain a patient's permission prior to blood collection. If you do not get the proper consent and you go ahead and you draw on the patient, and you find out later the patient did not fully consent because he didn't understand you, he couldn't hear you, and you didn't validate and confirm everything, then you can be charged with assault and battery. The assault is that you told him what you were going to do with the needle in the sense of you were going to draw blood, and the battery is that you actually did it. You actually touched the patient and stuck him with the needle. Now, if the patient is a minor under 18, consent must be obtained from a parent or guardian, regardless of what the minor tells you. So if the minor comes in and they're 17 or 16, and if they're in a state where 18 is the adult, some states do have 16 and 17 as adults, but if you're in a state that's 18 and over, or it is 16 or 17 or older, you need to verify. You cannot draw on the patient if they are still a minor. You have to have consent. So make sure you validate the date of birth and all the information before you perform any procedures.